My name's Orla, and I'm delighted to share with you my journey in medicine, and thank you so much for the opportunity to do so today. I thought I'd start with a very brief overview of my personal timeline. I graduated from UCC, getting great representation today, in 2013, and did my intern year down in the People's Republic before I moved up to Dublin to undertake my BST training, and then being granted move straight from SHO to HST in respiratory medicine. I had a very, very big opportunity during the first year of my SPR program to undertake my MD, actually a little unusually early in the course of normal things, and that was in a collaboration with a lab over in London. So I was able to take a full-time clinical out of program year as my second year to continue all of those studies and move on from there to complete my HST through Vincent's and Beaumont, writing up my thesis at the time, being conferred in April of 2020, a very busy time for us all, and eventually being awarded CSCST in July of 2021. In line with my very major subspecialty interest at the time, I undertook a post-CSC-ST fellowship in Ireland, in St. Vincent's Hospital, also in the area of CF, and then had a very small overlap with my first consultant post, which was commenced in March of 22. And I now work as a respiratory consultant in a very large respiratory department in a busy teaching university hospital, where my now main area of interest is in airways diseases. So that's me in a nutshell. And I thought it might be salient to pull out some of the more striking factors about my very short training time from intern year to consultant. As I mentioned, I was in full-time clinical practice throughout. I did have a very short training time and subsequently landed into a consultant post at the age of 32, which has very significant and unexpected challenges associated with it. I was the lead NCHD for Vincent's, putting out fires all over the place during the pandemic, and that work and the fact that I still work in Vincent's has left me in a very central, albeit very undefined management role in the hospital, adding to the stresses and strains of daily consultant life a little. I have alluded to the fact in my timeline that I had a very significant turnaround in my subspecialty interest, and that really, really caused a big loss of identity for me that I think many of us grapple with and don't talk about, something I probably still struggle with. And all of that included, I'm now making those larger life decisions common to all of us from the bit of a precarious position of being in a locum role. So I think very much on topic for today, this journey and all of our journeys has really required a huge dose of resilience, illustrated here perfectly by Owen, a former intern of mine when I was in Beaumont. And really, what is resilience? I think that's the age-old question, and certainly I don't have answers today to those general questions of, is it taught, is it innate, how do we protect it, how do we enhance it, what tears it down? But certainly I thought it was a nice opportunity to give you an idea about where my personal resilience comes from and how that's allowed me to deal with such an intense journey through medicine. I'm glad I'm not the only one giving travel tips, but this is Blennervan Windmill, just a stroll down from my family home in Tralee. I'm a Kerry woman, and certainly while there's probably a bit of innate resilience that comes with being from Kerry, that's not the point of this slide. I credit a lot of my resilience to the fact that I had a childhood spent in the local music school. I am a cellist, I'm a pianist, I am a reasonable flautist, depending on who you ask, and that has allowed me, I think, to grapple with some of the challenges that I face in everyday life as a consultant today. So I think if we were to look at my timeline again, it could easily be rewritten to reflect a childhood spent very much hanging out at the back of the chorus line in drama productions and dance shows, giving me all of those wonderful skills to come and present to you all today and have the confidence in public speaking that's so innate in all of our job roles. I was an ensemble performer and still am and play in orchestras. That gives a huge amount of grounding in teamwork and leadership skills. The discipline involved in doing medicine, or doing music even, and playing the cello and piano to a high level, practicing, doing the exams, really was a discipline that's reflected, I think, in a lot of my practice day to day. And really more so than all of that, I think the joy and the pleasure of being able to pick up a cello when I get home as a very wholesome stress release has been a real happy time in my life and has allowed me to grapple with the stresses of the job that we all have. I still get to do that, so much so that I'm on my way down in the next week or two to perform in the orchestra of the Phantom of the Opera, a local production, alongside a local GP, Angela O'Donoghue, who is the second cellist. So it's worth saying there are thousands of medical musicians and musical medics across the country, serviced beautifully by organisations like the Irish Doctors Orchestra, the Irish Doctors Choir, some people keeping that practice to themselves and having that lovely time to de-stress at home on their own. But certainly I credit that with my ability to have grappled with my journey through medicine, and I thank you very much for your attention today.
Thank you.